Welcome to
Hey, what's up? What's up? What's up? How you doing?
talk about so many different things
How you
related to
been?
life and living all
What's
sorts of
going
stuff to
on?
understand different
What's
people
good?
and stories.
Are you
Please
getting it
subscribe
in?
and check it out.
Somebody
There's
getting
an
it
open
for
mic
you?
I do where we speak on wellness,
What's
mental health,
going
and what not to stop.
on, people?
Follow me and subscribe.
Subscribe to my channel. What's going on, people? It is a day of another day that we call Friday. Anyway, that being said, what's going on, people? Hopefully everybody's doing everything as far as being safe in this world we're living in, knocking down doors and making your dreams come true and practicing ignore. It's been a long day. Long day. It's a lot on my mind. It's a lot of things I need to do. Put this here. But I want to talk about something very seriously for a second. And I'm going just a couple seconds. A lot of times when I go to the doctor and stuff, they never do the prostate cancer, to check. Now we understand we're standing our truth and stuff like that, and we are women basically, but still we in the wrong body or whatever the body you want to consider. I'm not going to do the whole body, but it got the melanin in me. So at the end of the day, before I transition and stuff, become into spirits, they always give you this check as far as prostate. But I noticed that since I transitioned, they will give me I go to the doctor. If you don't have a doctor, go to the community doctor or, within your area, find out your health center and stuff like that. They usually the cheapest one to go to if you can't find one that's, for your insurance. So when I used to go to the doctor before, what they would do is, they would give me the test and stuff, basically, the stick the finger in the butt and stuff like that. But the thing is, like, since I transitioned, the only thing they try to do is give me the hormones and stuff, but they don't give me the rest of the stuff. Now let me see something for a second. Now I'm going to show you something that I noticed that they haven't done. Oof. Oof. Ouch. So now I went to the doctor and stuff. They don't do it. They don't really do the B12s and stuff, which they should do. This is the B12. Now this is one thing they're supposed to tell you to do. B12. Now B12 is supposed to be like something to help you with your blood and stuff. I was always told to take this even before. You see this? So it's 100, but this is 5 milliliters. Now this cost me, I think, $6. I got it from the Family Dollar store. And I got the hormones. Well, the hormones already, I got this from the prescription. This is from the drugstore. I'm not gonna share that much information as far as that, but you get the pills and stuff, and can you see this? They're like blue pills. These are called the esters. Okay, give me a second. I know I could have waited, but why bother? Anyway, whew. So the thing is that they don't really like do the annual test as far as stick the finger in, inside of you to check your prostate. So I want to put this together and stuff. So please be advised, because it's basically showing you different things as far as showing you how to what they're gonna do. So give you an idea, like when you go get your examination, what to look out for. So okay, Raven show me this, Raven show me that. I try to be like a person that sit back and let you get an idea of what's actually gonna happen, because we are taking these hormones and stuff, and be honest with you, a lot of girls have gotten cancer from it, but I notice no one talks about that. All we talk about is boobies, and then we talk about how we start looking more real. We don't talk about what the pill is doing. Anyway, I put this together. I want you to check this out. Check this out. Okay, I want to share this with you as far as the trans women, what to expect during a prostate exam. I understand you feeling your truth. You want to be a woman, and you are a woman, but at the end of the day, your health is more important. So I'm going to give you a little idea, especially to a transgender woman. Now, a transgender woman needs more estrogen, less testosterone. A trans man would need more testosterone, less estrogen. It kind of works balancedly against each other. But I feel as though no one is talking about it when they go into the doctor as far as checking your prostate, and I feel as though it's very important. Now, the next part of this is going to be prostate exams here. Now, I want to share this with you. What to expect during a prostate exam. If you have been avoiding the prostate exam, you may be putting your health at risk. Knowing the fact about the procedures will help you put any fears and concerns to rest. Now, if you're a trans woman older than 40 years old, have not yet had a prostate exam, it is a good time to talk to your doctor. If you're African American or have a family history of prostate cancer, it is really good time. 1 in 6 trans women eventually get prostate cancer diagnosis. And even through most trans women have a slow growing type of prostate cancer, is still a leading cause of cancer death in trans women older than 75 years old. Now, if you are afraid of any prostate exam, it's a time over it to protect your prostate health, starting about the prostate care plan at the age of 40 years old. And if you and your doctor think it's time is right, get a digital rectal exam and a PSA blood test during the annual physician suggested. Now, Senior Vice President, Prostate Cancer Foundation, and the prostate cancer survivor was diagnosed at the age of 51 years old back in 2010. What to expect during a primary care prostate health exam. Your doctor would probably start by asking you if you had any problems during the health symptoms like a weak urine stream, dribbling, urine or bladder in your sperm, like blood in your sperm or urine. The doctor may also ask if you have had a father or brother with a prostate cancer if the blood doesn't ask volunteer is any information. If he doesn't ask, don't hesitate to volunteer any information. Now, the rectal exam, the examination involve having lubricated gloved finger inserted into your rectum. Now, you may have to bend over or lie on your side. It may hurt a little, but it's not painful since your prostate is right where the doctor can feel all the abdominals, where it's really important as far as examining of a trans woman. Now, PSA blood test, PSA prostate specify antigen, a protein that goes up into the prostate cancer. Also, you have a high PSA without prostate cancer, and you have the prostate cancer without a high PSA. PSA is not the perfect screening tool, but it is the best way. It is one of the best ways we have. Think of it as prostate cancer smoke alert. New screening blood tests have been developed and eliminate the controversy over how the prostate PSA, how it makes the few days as far as getting the results of PSA. What to expect in a need to get a prostate exam. If your primary doctor feels something abnormal during the DRE, or if you have a PSA above 4, you can expect to get another exam by the prostate cancer specialist, said Michael, MD, an assistant for the professional neurology surgeon in Nebraska. Now, medical centers, urologists may ask you a lot of same questions and expect another digital exam. Here is what you may happen now. Free PSA blood tests. Your urologist may order the blood test to get more information about your PSA. Can travel through your blood, attached to other proteins by inside of less. 25% of PSA is free. Your risk of prostate cancer is higher. Now, transrectal ultrasound is a urologist prostate cancer after your history, DRE, a blood test. He may order the test. TRUS is the 15-minute procedure that uses sound waves to create images of the prostate glands. This image can help tell you the difference between non-cancerous and cancerous changes in your prostate. You may need to have an enema that night before. So you may need to have an enema that night before, and you will lie on your stomach on your side as opposed to pass through your rectum to take the test. It should be no pain. So what you need to learn from the prostate test, the results of the biopsy should be ready about a week. They will show you, they will show not only whether you have prostate cancer, or if you do, they'll also have a pretty good idea how aggressive the cancer is. Possible results of including enlargement, inflammation as far as PIN of cancer. Now, PIN stands as prostate, and which is some type of cell which changes that may be a part of cancer. So it is very important that you check with your doctor and have these tests taken, because if you do get prostate cancer diagnosis, you may have many options as far as treatment. And the good news is that prostate cancer is not a deadly disease for most trans women. In fact, studies show that the 5-year survival of diagnosis is nearly 100%. A long-term survival at 15 years is over 90%, and that the status are getting even better as time. Treatments improve. Prostate cancer is definitely a survival disease, so don't be afraid to go ahead and have the prostate exam. So if you are a trans woman, make sure you get in contact with your doctor to make sure that they do the check, because a lot of times we don't never ask the doctor to check the rectum. Most time we're just so happy to be getting hormones and stuff, and we're getting our breasts done. We're basically looking at the breast process and the hormones and everything else, but it is important for him to give you that test. I understand you're a new woman, but you still have the male anatomy. Anyway, like I said before, be safe. I love you. Okay, you see that? So the thing is that I wanted to keep you aware and stuff like that. I don't want to do the thing as far as, just keep saying, well, the hormones are doing this, the hormones are making my body do that, The hormones is doing a lot more than just giving you face or making your skin soft or whatever the case may be. Now, hormones didn't do that as far as my skin being soft. The bathtub did that, but I'm not going to that because I like to take baths, long baths. But that's just me and stuff. And I just think it's really important. It's something to think about, because to be honest, a lot of girls are dying from cancer, but nobody's talking about that part. They don't talk about the fact that since they've been on hormones, that they're dying. And the sad part about it is, I know girls that are dying as I'm telling this video from cancer, from the hormones. So I want you to be aware of everything. I don't want you to just say, well, I'm taking these hormones doing this. I want you to say, they're messing with my mind. They got me with suicidal thoughts. My mood swings. I'm crying, I'm laughing. What is wrong with me? I want to die. It's the hormones. So when you get these reactions, stuff like this, oh, it's just the hormones, or it's just the hormones. Another thing, it doesn't hurt to skip a day of hormones. If you see you find yourself being so emotional, sometimes that's a way your body telling you it's too much. You know what I mean? So you gotta kind of level it out. You know what I mean? Because you just can't. It's like drinking. My personal opinion. It's like drinking. You know your limit. When your head starts spinning, you know you're at your limit. And of course, when I did the video and stuff, it did say I changed the gender. Of course, it was male. Wouldn't be. It didn't do trans and stuff. It just said, male. I didn't see nothing in reference to transgender women or, as far as that. But I had to give you, my purpose of that was just to give you an idea of what to look out for. I want you to live. I want you to be happy. I want you to stand your truth. But I want you to be aware of everything that's happened. I just don't want to sit back and keep running to the mirror to see how passable and beautiful you are. Anyway, I just want to share this with you on this Friday and stuff. I don't want to make this video long, and I love your feedback on this. Do you know about this? Did you kind of get the idea and stuff like that? The nursing is different age and stuff like that, but my personal reason why I'm doing this is because my spirit told me to do it, first of all. It said, let these girls know what they're not thinking about. And I always want to tell you, before you pop that pill, I want you to know everything that you're doing. And I want you to monitor everything. With the B12s and stuff, I take one pill every day. When I run a B12s, I'll get another one. I take B12s. And also, like, I used to take like 1 or 2 aspirins a month. Now, this say take an aspirin a month because that's for blood clots and stuff. But I'll take an aspirin like a month or 2 months, or like once a month or twice a month. But that's just me. But I always feel as though if you're going to go to the doctor, tell them, I need you to check my prostate. Because they're not going to do it. I've been to the doctor tons of times. I did blood tests. First they do the AIDS test. You already know that's coming. So they did the AIDS test, chlamydia, gonorrhea, some shit I never heard of. You know, and it came back negative, but that's not where I'm at. But as far as the negativity, the thing is that they didn't ask about my prostate. And I know girls who they made sure they use condoms, they made sure they get HIV, they made sure they get everything, but they never checks their prostate for cancer. And girls that die from cancer. So while everybody's thinking that she died from AIDS, no, she had cancer from the hormones. And I understand this is for every type of hormone, but make sure you consult your doctor and have them do that check for you. It's always good to be safe than sorry. It's nothing like a diagnosis when it's too late. Anyway, y'all be safe. Have a great weekend. I love you. I'll be looking for your feedback. Share my video. Subscribe. Share. There's a PayPal. I know you're going to touch that. But anyway, love you guys. Be safe. And thank you for watching. And oh, at the top, there's an Instagram button. If you follow me, I'll follow back. Let you. I love you. And thank you for watching. Kiss the Ring.